surgery that he did, and that's very normal. The issue being, now they're being relied on a little bit more since the surgery, and they probably can't tolerate it very well.
What do you mean? Oh, the nerves?
No, the muscles and whatnot, and the nerve. I mean, the nerves that are there too.
So here's the thing, and I've had, I talk to a lot of people, or I talk to people, and not everyone's a professional in any such field, but everyone was kind of blown away that they're like, "Aren't you on pain meds?" I'm like, "No." And after the surgery, I had literally no pain meds for 3 months, nothing. It was just rehabbing my legs, the urinary retention, and that was it. So that was my focus. And then, collaborating with chemo and stuff like that, I wouldn't say I was rushing there because I was doing great. My numbers were getting better, eating, food, all the things that I should be having, I wasn't, as far as having the cancer. So now I'm like, it seems like Nick, talking with Nick, he's been great. So just collaborating with him, and I'm just like, I'm at a point where, well, for one, is the pain the cancer, and two, I really don't care what I'm dealing with, even if it's full blown. I gotta get first. I gotta hit the pain first.
Sure, yeah.
I can't even I'm losing it because it's just so mentally hard, man. Well, it's not all the time, really. Like, for instance, yesterday, and some people think I'm crazy, or maybe it's mental, and I don't know, like, I'm from Florida, so I've been there the last 11 years, and I'm just like constantly beach, constantly sun, constantly just out in those elements, and then I come here to kind of, like, my parents were helping me, I didn't realize this was going to happen, and all I can say is predominantly there's a correlation between not so much cold, but always it seems like cold and wet. When it's snowing, or there's a wet environment, like yesterday, or just before I came into emergency here, I went out they're like, well, we should leave you home. I go, no, I'm going to go. I mean, we live on a dirt road in the middle of the country, so we're driving. My brother's hitting bumps. I mean, it just rained, and I was just like, not even. I mean, there's always that one area but sometimes that even goes. Like last time I was in emergency, I woke up, and I don't know what it was. I wasn't on no painkillers, and I'm like, holy shit, man! Like I could lean over like that. I mean, I was like, it was like almost all the pain was gone, and I couldn't put it. Like, why?
Yeah. I mean, we can try a different cocktail too to try and help with some of that stuff. It's so part of it, yes, come and go for
sure. About pain medicine?
Well, pain and like anti-inflammatory and whatnot. Just try and find the thing that works the best, right? And last,
they gave me morphine,
the longest.
And I was on it, and I will tell you, I'm starting to deal with a mental problem now. Like I'm a go guy, and I'm sure I'm not the only one that's just, especially in this duration where I'm a very active person. I don't sit for long. And then when it's like, oh, you can't move, and then whether I'm either being told I can't move or wait to move, or I'm in pain to move, and I just feel like I'm being suffocated. So that doesn't really help with some of the pain meds. And so, but I don't think that's a factor with the Oxycontins and the other ones, which didn't agree with me. So they put me on morphine, and they gave me an extended morphine which didn't, it sort of worked, and then I was on the oral as needed dose. And I waited, and I took that, and actually I wasn't on anything the other day before I came here on the morphine. And then I took it, but it still wasn't even enough with the morphine.
So the thing that I'm trying to determine, one, I mean, like, do you need? I mean, we could get another MRI of your thoracic spine and make sure like there's no recurrence there, because like there can be, obviously, and like it'll come back. And depending, have you been in chemo radiation or no?
Okay, here's another thing. And I had two doctors come in, and they're scratching their heads. And I will tell you, I'm not a doctor, but I'm pretty good at putting two and two together, or just making common sense, or why this and why that. I mean, I'm not a medical person, but I'm intuitive, and I've been having conflicts with a lot of things that, maybe one person says or the other. Not that they're wrong or that the other person, but that the information is conflicting. So, with the I went to 3 radiologists. Now, the reason why I backed off on the radiology, when I first went to radiology, is like, well, it's not going to hurt no problem. You know, I'm like, do I need nausea medicine?
Mm-hmm.
Like, no, we zap you for like 5 minutes and you're good.
Mm-hmm.
Came in, 5 minutes, was zapped. And I will tell you, I mean, I'm 48. I'm not crazy. I mean, I may be going there.
Yeah.
But this was before maybe I was really starting to have the mental problems. Maybe just, and I wouldn't say problems, but just not coping with the level of pain I'm dealing with the last 3 weeks. But probably right around when I started coming in emergency more. And anyway, came in for radiation. And everything was basically fine, mild pain, nothing.
Sure.
Went home and I couldn't feel my ass. My ass was like, didn't exist. It was like a void.
Mm-hmm.
But the pain was just as bad as this,
Mm-hmm.
constant though. And it was just from that radiation spot.
Mm-hmm.
So then I barely got to the hospital, and then they said, well, maybe it was just something with the radiation. So that kind of put me off on the radiation, but then I was like, all right, I'll keep going. So I went 2 more.
Mm-hmm.
And then I think on the second one, the second or third one, I was scheduled for a third or fourth,
Mm-hmm.
a fourth radiation, and then I had another pain episode,
Mm-hmm.
and it was right when it was snowing.
Mm-hmm.
And then I came in, I'm like, you know, and then they didn't schedule me because the radiologist came in.
Yeah.
So we don't see, and I don't even know what I was thinking. I should ask him, but I think I did ask him, but he didn't give me a direct answer. But he said, I don't think you need radiation anymore. You're good. So then I had 2 doctors come in and say, why would he say that? I'm like, I don't know.
Yeah, I'm not sure either.
And then there was another nurse when I went into emergency. She did a comparison with a CT scan they did and an old one, or just comparative with the tumors. I didn't even ask, but she was offering and saying, you know, your tumors are minimizing, or the ones that were there. And one last thing, I did have 3 up here, I guess. I don't know if you saw the whole thing, which I was excited to see.
Tumors or what?
Tumors, yeah. 3 up here. There was like 1 here, right? And
Yeah,
2
there's
down
one
there.
at L5S1 that's huge.
Yeah.
So that's the other thing. I know we talked about. I think we talked about that the last time when we got the MRI. Like, you just have one that is totally.
And that's when they were
engulfed.
hitting with the radiation.
Yeah, because the problem with that one is, I mean, so I came up here because Nick was like, hey, you know, he probably doesn't want surgery, but you know, like, the problem is I'm trying to figure out where the pain's coming from, but
Yes.
you've told me that it's coming from that area,
Yeah.
and so like, I'm not gonna go into L5S1.
But
if
let me
you're not
just say
hurting there.
one last thing.
Yeah.
Those pain, like I was having, I wouldn't say nearly the pain here, but it was
Mhm.
bad. I mean, I was like, and then I was like, okay, this myeloma must be kicking in. I'm like, all
Yeah.
right, let's get on the chemo. So that's when I started realizing, okay, but then I don't know if it was my diet or just, you know, I'm a pretty healthy guy. I've never been in
Sure.
a hospital.
Yeah.
Never been sick ever, really hardly,
Yeah.
ever in my life. And so maybe a week or 2 went by, or all I know is I haven't had no pain here. The pain down there, no pain at all.
Yeah.
L5.
That's good.
It's a little numb, or it's a
Yeah.
little tingly, but it's I can punch it. I mean, I could hit it. I could punch it right now. It's not. It's just where the surgical area is. From
Yeah.
what I mean, where I showed you, is that kind of where it is, right?
Yeah.
Can't
It's-
see 'cause
It's
I'm
radiating
back.
right out from that area. So it's
So-
basically following your ribs out, and that's the nerves that it hits when you're in there. So, I mean, the question is, we could get another MRI of that area, and that's fine. I don't know
Let
what
me
it's
just
going to
tell you
show
one last
necessarily,
thing.
but
Let me just tell you one last thing, or one additional thing that
Mhm.
I'm making a problem, and I'm sorry, but I'm having issues with claustrophobia now,
Sure.
and like just massive panic attacks.
yeah, I mean,
And-
you've been
and
in
I-
the hospital room.
Well, no, not so much here. It's just when I can't move,
Yeah.
and then I try to, and I think it's the meds. Like for whatever
Mhm.
reason, the Dilaudid seems to keep me not so. I know it's stronger, they say, but regardless of the pain medicine, I tried 2 MRIs and I was I couldn't get through though.
So the other thing I would say too is
I'm just a
because
mess,
no,
man,
I know.
sorry.
Well, you have a lot going on, man, and like I feel for you, and I feel terrible.
Well, it's not
The other
good,
thing to
man.
do would be to ask our psychology to come up and talk with you as well. And I know that sounds like iffy.
Hey
but the
man, I
biggest
appreciate
thing-
just anything like just
Yeah.
someone saying, "Hey man, we're gonna get you through this."
Yeah, and what they're gonna say is you don't meet inpatient psych criteria, which is fine because I don't think you do anyways. But what they can do is they can optimize some medications for you to try and help with some of that stuff. I'm just
Yeah.
looking for symptomatic relief.
Yeah.
Right.
Honestly, if I could get, even if my body's like, dude, you're in pain, but I don't feel it,
Yeah.
and I don't want to be like, and I told my mom like, you know, I don't want to. I was joking before, like, what do you want me to sit here and just in a comatose?
Yeah.
But I'm almost like considering if I had to be just like sort of out of it to not. At least I know I can get up
Yeah.
and push through it.
Well,
But I
you're-
can't push through nothing.
Yeah,
I
yeah.
can't push.
And you're hitting kind of that depression part of the whole, like, one, it sucks outside, like that is what it is. but
I miss
I would
Florida.
much rather be in Florida too. But the reason that happens is because you get in this pain cycle, right?
Yeah.
And then
You feel like
are
there's no
coming to the
hope.
hospital and then all this kind of stuff. And so, you know, if we can optimize some different things, rather, you know, pain control, psyche, all that kind of stuff, like,
But I
just
mean,
together, you know,
okay,
like,
and I'm up
I'm
for
not
it,
saying
all of
goof
it.
you, I'm not saying goose you out, you know, like, I'm not saying make you a vegetable or anything.
But I mean, I may even I mean, I really do appreciate, because I will tell you, get a lot more activity being
Yeah.
here.
Yeah.
And then I'm with my parents; they're older, and they're like loading me in
It's
the
hard.
car.
Yeah.
So they almost want me here, and I feel like I'm getting, but I don't want to be here. But it does seem a
Right.
little bit more beneficial if I could just get something that would just kind of get me at least where I can help myself.
Yeah.
Which is mainly the pain. But now you're saying psychological. Is there any remedy that? Is there any hope for physical?
Yeah, I
fix?
think multimodal, you know, like if we can get you with an anti-inflammatory and a steroid, that's going to take care of the swelling that's back there that happens because of the surgery.
Is there a reason why I'm not on
because of the
steroids? When
tumor.
I'm here, they give it to me, and then when I leave, they don't.
Yeah, we can only give you IV here. We could send you on steroids. The problem is that when you're on them for a long time, it goofs with other things, and so you try and play like that game of
Gotcha.
like too much or too little,
Yeah.
you know.
Mm-hmm.
But you may be one that just need them, and if you need them, you need them.
I mean, I'm, you know,
And the other thing would be pain control, you know, pain control, symptomatic control, you know, psyche control, however
Yeah.
you want to.
Sure.
Talk
You know, you're not
about
offending
it.
me. I get it.
No, I just,
I'm
it's out
not.
of my realm.
I'm
It's
not
just
all there.
my-
My parents would probably say, "Yeah, he's going crazy."
No, I don't
Trust
think you're
me.
going crazy. I think you're with it. I think it's just you've gone through a lot, and you're going to continue to have to go through a lot. Honestly, like this, and I'm not trying to like be shitty or anything about it, but this is probably the tip of the iceberg, right? Like things are gonna get different,
Yeah.
and it's one, learning how to deal with those. Two, you know,
I think
how
if
do
I
we
could
figure
manage
that
the
out?
pain,
Exactly.
I really think I'm a pretty tough guy.
Yeah.
But when you're like, you know, like I think I could be that guy that cuts his arm off because he's lucky. He's
Yeah.
lucky, but I couldn't do that every day.
No, exactly
You know,
right.
I mean, I can't. It's the duration.
Yeah. For me, then, what I would say is no surgery. Okay.
Okay.
Let's get pain management on board. Okay. Let's get psych on board.
Okay.
Let's just throw kind of the kitchen sink at everything and try and get you. You should be on steroids. I think you are right now, so we'll keep you on that. Probably send you
Oral.
home. Yeah, and send you home with them as
Okay.
well.
Yeah, please.
Maybe you go to rehab for a little bit. You know, maybe it takes the burden off you and your
Is
parents.
there, yeah,
and-
that like just something where
Yeah.
even just people to talk to that are in my situation.
Yeah, exactly,
like,
exactly. So
Is that such a thing? I don't know my insurance. I mean, my insurance.
it
is
just
pretty good,
depends. Yeah, around here it's gonna be tough. I
Yeah.
mean, it's
but going down the city.
yeah. You down in the city maybe for sure, but
So this would be something we'd have to pay out of pocket. Then.
not necessarily. Your insurance might cover it, but it just depends on like your whole clinical course and what they decide and all.
Yeah, I know.
It's kind of out.
I
of
get
our
it,
hands,
right,
which is
so,
annoying,
yeah.
but so I think that's where we start and go from there. Like
Alright.
I'm not planning on any surgery unless something changes, obviously. But I mean, for the most part, like you're stable as far as that goes. It's just the pain is what you're telling me, right? So
Yeah. So
we
I
gotta
mean,
get you out of as much pain as we can.
is there
Zero
any
pain
approach
is-
you can give me as far as stopping actually the pain?
Yeah, so what I want is pain management to see you, because what they can do is optimize your medications, because you say the ER doesn't work very well for you, the morphine, the IR is not doing exactly what you want either. So then, okay, is there a different version that we have to switch you over to in order to get you the pain control you want on top of multimodal? Is it a pain medication, a muscle relaxer, a nerve pain medication? You know what I mean? Like, can we add all that stuff in so that you're getting the pain control you need kind of overall? And so like each of them is hitting a little different place. And then psych on top of it. Psych, the meds that we use for psych overlap a little bit with pain management. And so
Okay.
now they can help with optimization of that, right? How do we, because as soon as you become depressed, your pain threshold decreases.
I wouldn't say it's
intensely.
depressed. As
No,
much
I'm not
as it's,
saying I'm not saying that either. I'm
Yeah,
just
yeah.
saying like once you get into that cycle,
It can,
of-
yeah.
it just
prevent,
it's
yeah.
a snowball effect, and it gets worse and worse, and it just you can't. It's hard because you want to control it, and I know you potentially can,
Yeah.
but it's very very.
Oh yeah,
very
you got to be in
difficult.
like yoga mode.
Yeah,
like, hold
it's
on, me.
very difficult. So
Now,
we're trying to help.
There was a
We wanna help
report
with that.
made and I was still looking for it, but like inner modulary something
Mm-hmm.
on the CT scan that came in last.
Intramedullary, yeah.
Is that anything correlated?
Yeah, so that, I mean, what that means is that the disease is just in different areas. So it's, instead of just being outside, it's on the inside as well. So like of like the actual nervous tissue. So
Okay. I mean,
it's a tough disease. Probably, I mean, chemo is going to be one of your best bets,
Okay.
honestly, because it
Why?
treats it. Yeah, it treats it systemically. So the radiation's good for post-surgical because it'll hopefully prevent recurrence. But you can't radiate your whole body necessarily.
yeah, right.
And so chemo is a little bit better.
Or will
for
we
that.
radiate the surgical area?
Yeah, they did. Mm-hmm. Like you
Well,
said.
no, I
they
thought
did.
that's not what, when I was going to radiation, they were doing the L5.
Oh, they did. They didn't
Yeah.
do the surgical area.
No, not at
No,
all.
they should have been doing the surgical area too, and I can talk to them about that.
I mean,
Because-
yeah, maybe that. Why don't we do that? Or here's my thing: like, could we? I mean, put it this way: I don't think well, it would be a little scary, like to try different things, but maybe radiation would cut that pain.
Yeah, and it can.
Could there be a tumor that grew back there?
Yes, there could be.
Is
But-
there a reason why we don't kind of? Is it because of?
Well,
can't
that's
get
you
an
look at
MRI?
it. We'd have to get MRI again.
And then how would I do that?
Yeah. So, let me do some legwork on the back end. I'll see what I can do for you. Okay, and we'll see if we can make you better.
Well, I did have an appointment with you, but you know, I
Mhm.
don't know.
No, I know you're in here, so that's
I was
fine.
really just wanting to see the images if I could. But I don't know how.
Yeah.
You know, I know when you want to see them, it's like, but when you see them, it's like it
It's
just
a little
looks like a
different,
bunch of
yeah.
yeah.
That would be my plan. I mean, no surgery, and then just kind of work on some of this other stuff as much as we can. Talk to radiation, talk to psych, talk to pain management. You know, talk to the primary docs as well. Just make sure.
I mean,
everything's-
you know, you can level with me, man, if you think there's really no way to go but chemo for the pain. The
No.
pain is my number. Like I said, the cancer's second. It's just
Yeah.
because I know mentally I could probably get through the harder stuff if I
Yeah.
knew I could kind of be a little bit mobile.
In reality.
Oh, also, now the pain. Oh, go ahead. I'm sorry.
Yeah. In reality, the chemo, radiation, pain meds are never going to take it down to zero. Probably.
Right.
That's the reality of it. Can we get you close or just manageable? Yes. But can we take it all the way? No.
You think it's from the surgery then?
I just think it's an overall like surgical plus the disease plus a lot of stuff going on, not being able to be as functional, that kind of stuff.
What about the legs and the pain?
What about 'em?
Why? Because Nick was saying that this is L5S1 correlated, but
Mhm.
I have to think that when I had the surgery, I had the legs and the urinary problem, which I do have again.
Mhm.
Like it's not bad as it was before, but I have to sit there and wait like 10 minutes before I can piss. So I just sit there and wait, and then eventually it starts to come out, and then I have control.
Yeah.
But before I had a cath straight right after. So right after the surgery, I had a cath, and then I had a urinary, and then my legs. And it seems like ever since the pain returned,
Mhm.
that returned. So I don't see because
It
Nick
can
was
be
like,
possible, but the only way for me to know is to get a new MRI.
I mean, I don't know if they could give me something that could knock me out, or
I mean, we could make you loopy, yeah.
I mean, I went to the MRI when I first came in because, like I said, I wasn't really dealing with all this. I'm like, no big deal.
Mhm.
But then after medications and all that, and then I just started having more mental challenges with it, and I was just
Yeah.
I couldn't get through the stupid damn freaking. I was
I
panicking.
mean, we can try. We can give you medication, see if we can kind of make you as loopy as possible with you still
Yeah.
breathing, and
Yeah.
try it again. I'm fine with that. I have
Yeah.
no problem with it. So
Could we try to do that
Yeah,
before I
we
get
can try that.
discharged?
yeah,
I'm just anything you could help.
Yeah,
I know you're
of
only
course.
one man and you're not.
no, I'll do
but-
whatever I can for you. That's why I'm here. So all right. All right, buddy. Well, I'm gonna do some legwork here. I'm gonna talk to Nick and everything too, and we'll get some stuff together and see what we can do. Okay? Hang in there. Just keep fighting. All right. That's all you can do.
Yeah.
All right.
So you're thinking chemo and then check the MRIs. That's your next steps.
Yeah. All right.
Cool, man.
All right.
Thank you for stopping by.
Yeah, you bet. Have a good day. Okay.
You too.
Thanks.